Dr. Thomas Verny, a distinguished psychiatrist and accomplished writer, has made significant contributions to prenatal and perinatal psychology, teaching at prestigious institutions such as Harvard University, University of Toronto, York University, and St. Mary's University. His journey began with the 1974 publication of Insight Groups and the Sibiskin's international bestseller, The Secret Life of the Unborn Child, in 1981, and co-authored with John Kelly. As the founder and the former president of APA, his groundbreaking work explores the impact of early experiences on personality development. With influential books like Pre-Parenting and The Embodied Mind, 2021, Dr. Verny is a leading authority recognized globally for his expertise. So first question I'd like to ask you is, how does an argument between a mother and the father affect the fetus? Does it affect the fetus? And if so, how detrimental to the fetus is it? Is a question. Yes.
Okay. Well, first of all, how an argument affects the fetus, which I like to call baby, because fetus is this Latin word, and it makes sort of the baby into a thing instead of into a person. So I like to avoid the term fetus. But in terms of what it does is it upsets the baby, it stresses the baby. One argument is not going to make any difference. 10 arguments, an argument every day, every couple of days is going to make a difference. And so the baby reacts to stress, and certainly an argument between parents is very stressful, not only in terms of what the baby hears from outside, but also all the neurohormones that are reaching the baby from the mother through the placenta, right? So it's kind of a double stressful situation. First, what it hears, what he or she hears, and then secondly, what she experiences through the bloodstream of the mother. So if this happens to be a very rocky relationship, it's going to affect the baby in the way that all stress affects people. And, you know, I have lectured on that, and it takes a couple of hours to explain everything that happens when somebody's under stress. But let's just say that it's not very good. So I think that if the mother or father have one argument, or an argument once in a while, it's very important after the argument is over to say to the baby, the mother and father together, if possible, because we are dealing with a sentient being. You know, this is not a little fish swimming around in a pond. This is a baby. And so it listens and it hears. And so you have to say to the baby, I'm sorry, we upset you. We had this argument. It's not about you. It's about us. We, both of us, still love you. We cherish you. We look forward to having you. Don't worry. Things will work out.
Just saying that it's not about you. It's not about the baby.
But it's not about you. That's very important. That's very important. Because all young people, children and babies included, always believe that they are the source of trouble.
Oh, then they start blaming themselves.
Yes. Yes.
Oh.
Perhaps I shouldn't be here. Perhaps it's my fault. I shouldn't have come. Things like that. Babies and young children, rather than blaming their parents, always blame themselves.
May I ask why is that is?
It just is. It's just the way things are. Yeah.
I didn't know they are that naive or just easy.
Well, I wouldn't call that naive. I think that's very clever, actually. Yeah, it's just that they don't know any better because,
Ah,
they are still in utero.
mm,
So, yeah, I suppose naive in the sense that they don't know any better,
ah,
but not
mm.
naive in the sense of stupid.
But you mentioned that mom and papa together apologize.
That would be very nice. That is the ideal. If you can't get
Mm.
that, then have the mother explain what happened.
Oh, I see. Okay.
Yeah, we have to be practical. Sometimes the father is away for a couple of days,
mm, mm,
or he perhaps stormed out of the room because he's upset. So, so you speak of experience, I can see.
Yes, I'm familiar with those
Yeah,
circumstances.
yeah, right. So these things happen. So, you have to you have to do the best you can under the
Mm,
circumstances. You have to be practical about it.
mm, I see. That's interesting. I never thought of this idea of apologizing together with the
Mhm.
husband. Okay.
And
I
explaining
think
to the
that one.
child that it's not its fault. That's very
Mm,
important.
okay. So the next question, asking when the labor is progressing slowly, what is the baby thinking during that moment? Can you explain that a little bit?
Well, I don't think anybody can tell you what the baby is thinking, just like just
Ah,
like I can't tell you what you are thinking at this moment. I mean, how would
ah,
I know that, right?
mm, 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 mm.
Uh, I think that during labor, the baby is very stressed, very troubled.
Mm,
Uh, if you put yourself into the place of that baby, it's being squeezed, right, from all sides.
yes.
Um, it's moving in a way, but not moving fast enough. So
Mm,
I think that there would be, a lot of stress, a lot of worry, but I don't know what that baby is thinking because nobody knows that,
mm,
and and I can't read minds.
mm. Okay, so some babies might be too stressed, or maybe some
Yeah,
get.
yeah, I think it will vary from person to person. The important thing is to get that baby out of there as quickly as possible.
Mm, because the longer it takes, the more
Yeah.
pressure
Oh
or
yeah.
the
Oh
stress.
yeah. Yeah.
Mm,
Yeah.
mm,
Yeah. It's difficult for the mother and it's difficult for the baby. So it those long labors should be avoided if possible.
mm, mm, mm. Makes sense. Let's move on to the next question. She went through a cesarean section. How does the child feel during the procedure of cesarean section, and how different is it from natural birth? I think you mentioned that in the Secret Life of the Unborn
That's
Child.
right.
Yes, and I
Well,
that
yeah. Yeah.
yes,
Yeah,
and
but
also yes.
yes, I do. Yes. And since that time, in many other publications, yes, I think that there's a big difference for the child who is born naturally without cesarean, even without forceps.
Mm.
Naturally born is the best way. Um,
Mm.
but with cesarean sections, several things happen which are not good.
Oh.
The first thing is that many cesarean sections are started after the baby goes down the birth canal, but it cannot make headway, like it gets stuck. So then the obstetrician will resort to cesarean section. So
Mm.
this is a baby who has gone a certain way and then got stuck. And then he or she gets rescued, so to speak, by the surgeon, right? So the first kinds of imprints, thought imprints on this child are going to be, I can't do it on my own. This will be like a film script, okay? Like a script. The first experience I have of coming out into the world is, I cannot do it on my own. So this is going to carry on forward as one of the sort of underlying beliefs, unconscious, of this baby, you see? The baby will never know this, but like gravity, we don't know about gravity unless we try to jump up and then we immediately come down. That's when we find out that there's gravity. When I'm sitting in my chair, no gravity, right? So it's the same thing. So secondly, in terms of health, when the baby goes through the birth canal, it picks up a lot of bacteria, including lactobacilli, from the mother's uterus. When the baby doesn't have that advantage, it's taken out. The first bacteria that it will meet are the bacteria on the abdomen of the mother and in the operating room all around, like from the doctor and from the nurses and everything. So two problems. One is that the baby does not have the lactobacilli. Without the lactobacilli, it will have problems digesting mother's milk.
Oh, interesting.
Right. I mean, nature is very clever. I mean,
Yes,
this is,
indeed. It is.
this is set up just correctly. So
Mm,
the lactobacilli the baby picks up on natural childbirth will help it immediately to, breastfeed. Without lactobacilli, the baby will have trouble digesting the milk. So it will not want to go on the breast. There will be all kinds of complications, difficulty breastfeeding because it doesn't taste the milk, can't digest the milk. And secondly, there's always the problem of secondary infections from the staphylococci that you pick up in the operating room, sort of lying on your mother's abdomen, perhaps after the C-section. And very often also C-section babies are born prematurely. So then the baby, because it is premature, is put into a bassinet.
yes.
And it's this little glass box or plastic box, right? And it does not connect with the mother. So when a child is born naturally, the doctor or midwife will pick up the baby and put it on the mother's breast. There will be immediate the beginning of bonding and attachment.
Indeed.
When the baby goes into a bassinet, there is no contact with the mother's skin, and bonding attachment are interrupted. So there are millions of reasons not to have a C-section if you possibly can do it naturally.
Great tip. I think you mentioned the cesarean section. Not the good points, but bad points. The current medical system, the whole thing in this book, The Sacred Life of the Unborn Child, too. So yes, I got to review your perspective.
Good, but also in the embodied mind, I
Yes.
talk about that. Yes.
Okay, so I haven't read the book yet, but I would like to read that and then study your insight and experiences.
You can get it in paperback now, The Embodied Mind from
Yes.
Amazon.
I'll purchase that for sure.
Okay.
Thank you. So still related to the cesarean section. So I asked you how different is it from natural birth and how does it affect the child's character? Can you also mention that?
Well, yeah, I did refer to it very briefly when I
Yes,
said
yes.
that the child will feel stuck. And
Yes.
so when in life there are occasions when
Yes.
you are stuck, right? The whole cesarean section drama will be replayed unconsciously in his or her mind. And so this person later on in life, when they are 20 or 25, when they are stuck, instead of doing something about it, instead of acting, because they could not do it when they were in utero, they are waiting for someone to rescue them.
Lack of confidence or
Yes.
slowing,
Yes.
taking next
Yeah.
step.
Looking for help outside, not yourself, not help from me, not competency, but I feel so incompetent. Please come and help me.
Ah, I see. Interesting.
So
So,
there's a certain passivity then worked into it.
So, so in that case, those adults need to well, first, if they seek change, then they need to look back at their birth experience,
Yes,
sort of, and then just how they are born, almost, and then
yes.
just
That
okay.
would be very helpful. That would be very helpful if they could get in touch with their birth experiences and realize that they have this unconscious sort of message, script, as I call it, then that would interrupt the cycle.
Mm,
And they would be able to become more proactive instead of passive.
I see.
But let me just say one thing.
Yes.
What happens at birth, what happens before birth, very, very important. It's very, very important, but it's not unchangeable. Like this is not written in stone.
Mm,
Everything that happens afterwards will also be very important and
mm,
play into it. So there are many, many other factors. So even if you have had a traumatic birth or
mm,
a cesarean birth, doesn't mean, that you're going to suffer for the rest of your life. So I just want our listeners to keep that in mind, that
mm,
this is just one important factor in your
mm.
life, but then there are many others.
Yes, asking how should I cope with the cesarean section, because what she's saying is she's feeling a little bit guilty because what she went through, but yes, she had to do that instead of natural birth, she had to go to the hospital and then conduct the cesarean section, so
Yeah, I understand.
yes.
Uh, well, there's really no reason to feel guilty. She did not ask for it. It
Mm,
was put to her that this is the best thing. I mean, doctors have a way of persuading women that this is the best thing for you and your baby. Don't you want the best thing for your baby? Yes, 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 I want the best thing for my baby. All right, so we're going to have a cesarean section, and that's it. So, medicine is a very hierarchical system,
mm,
uh, very much part of the patriarchy that we have inherited for thousands of years.
mm.
Western culture, Japanese culture, all very hierarchical. So women, by and large, women and men, when their doctor says this is the best for you, they follow his advice, right? Or her advice. So I would say, please do not feel guilty. You did the best you could under the circumstances. And now, now that you know that your child may be stuck with this kind of a script that I just described, perhaps you can talk to the child about this.
Mm.
Again, it's so important to talk to babies in utero, but even afterwards, if you discover when the child is 5 years, let's say that this lady's child is 5 years old now,
Yes.
it's never too late to talk about, you sit down the child at a good time and talk about their birth and how I wanted to have natural childbirth, but the doctor said I should have a cesarean. I was listening to this broadcast by Hitomi, and I learned that perhaps this was not the best way for you to be born. And so I just want to tell you about your birth. And just that's enough.
Ah,
Can I tell you a story?
yes.
Okay. Um, One day after my book, The Secret Life of the Unborn Child was published,
Yes.
uh, a lady came to me
Mm-mm.
in my office, and she said, you know, when my child was born, she looked very angry. And so I commented on that, she said, to the doctors and nurses around, and they all laughed. And they said, oh, no, 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 that's just a natural look on a baby's face. Don't you worry about it.
Mm-mm.
So then she read my book and she said, what do you think? What should I do?
Mm.
And I said, talk to your child who was 12 years old by that time. talk to your child about this. Talk to your daughter about this. It was a daughter. So a week later, she came back and she said, this is amazing. I said to my daughter, you know, when you were born, you looked angry. Were you angry? And the little girl said, yes, I was. And
Oh,
the mother said, why? And the little girl said, because you wanted a boy.
okay.
And the mother swears that this is true, that all throughout her pregnancy, she doesn't know why, all through her pregnancy, she said, please God, give me a son, give me a son. She says it was crazy, but that's how I was thinking. So when the baby was born and she was a girl, I immediately fell in love with her. But throughout these last 12 years, I always felt that there was kind of a wall between us, that we could never really connect. So when she had this talk with her daughter, they fell into each other's arms. They cried. The mother said, yes, you're right. I was wrong. I was wrong to want a son. I'm very happy with you. Let's love each other. And they have lived happily ever after.
That's so touching, but astonishing that when she turned
When
older,
she was 12.
this,
Yeah,
yes,
she still remembered. She
yes,
was put back, at the right moment. People often ask, well, how is it that some children remember and other children don't remember? Well,
yes.
yeah, well, it all depends on so many different factors. But one of the main ones is that to gain access to the memory, you need
Mm,
some kind of a trigger.
mm, 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 mm.
So it's a little bit like you have, 100 books on your shelf, and you may have read them, but you don't remember what's in them.
Mm.
So when you go and pick up the book and open it up, it all comes back. So
Yes.
it's a question of going to the book,
Mm,
it's gaining access to the memory. And
mm,
for some people, it's very easy, like naturally almost. And for other people, you have to use hypnosis and LSD and hypnotherapy and all kinds of other things. But the fact is that the memory is there. It's just trying to get to it is difficult.
mm. I see. So the trigger is the key, but
Yeah,
so it really depends on the person that how they're gonna thrive to access
yeah, yeah,
information. And I think that relates to the next book, the embodied mind, and the
yes,
cell remembering things and having all the memory in it.
in
Each
yourself,
yes.
right. And the fact that the mother was able to be truthful and honest and really say what happened instead of saying, oh, I have no idea why.
Mm, mm. Be truthful
So
with
it's
yes.
very, very important with children. The younger they are, the more important it is for parents to be truthful.
I see. Oh, very good tip. If is telepathy real? And she also says, can a baby not only hear voices but also perceive thoughts and feelings? And also she goes, is it true that individuals choose their parents?
Okay, I don't know about the last one. Okay, the
Mm,
last one, I know that there are some people who believe in that. Um, I don't believe in that,
mm,
but I don't believe in that. But I think that in in terms of science, we have no evidence of that at all. That babies choose, and where
okay.
are they coming from?
Mm,
And
mm.
the soul's kind of wandering around. No, I don't believe in that. But what was the first part of the question?
The first question, is telepathy real?
Yeah.
Uh,
Okay.
yes.
Yeah, I got that. Uh, yes, yes. I think it is. I think that people can receive thoughts and feelings from others, but once again, it's very individualistic. It depends on who is doing the thinking and feeling, and who the baby is. Like, is the baby or child or the other person open or closed?
Open to enough to receive.
Yeah. I'm just thinking of another example.
Yes.
Like, again, in the embodied mind, I have a whole chapter. I have a whole chapter on that, on the difference between the mind and the brain. And, there are lots of, for example, well, the example that I just gave you about the baby who, the little daughter who picked up the fact that her mother wanted a boy instead of a girl, that's telepathy right there, right?
Yes. Yes, certainly. Yes.
Right. But another frequent example is that when you have twins, for example, when you have twins, and they may be hundreds of miles apart, but if one of them, for example, is in an accident, the other one, no matter how far away, very often, not always, very often will feel that something has happened, something is wrong. And they will call the other twin and find out that he or she was in an accident. Very often people who are very intimately connected, very emotionally connected, will have this kind of telepathic communication. So I think it is real, but again, it doesn't happen all the time. It doesn't happen with everybody. But when it happens, I think it's real.
I see.
So I think it's very important. Let me be practical. I think it's very important for mothers and fathers to speak to their babies, to their unborn children.
I see.
Now, you say that you are pregnant right now?
Yes. Yes, 8 months. Yes.
Oh my goodness. Has your husband spoken to the baby?
Yes. He does all the
Good.
time. Yes.
What does he say to the baby?
Hello, how are you today? Just going to work from now. Thank you. See you
Excellent.
evening, or just a
Excellent.
very casual conversation. Yes.
So I was going to say that it's very important for parents, both of them, to speak to the baby, in utero. And I have many examples of children who, for example, during the first pregnancy, the father was not home. Let's say he was, I don't know, away on army duty or something like that. And then during the second pregnancy, he spoke every night, just the way your husband does, to the baby. And when the second baby was born, he walked into the operating room and he said, "Hi, Junior." And the baby just looked at him and gave him this beautiful smile of recognition.
Very
Like, there is
nice.
no doubt that the baby recognized the voice. And the lady who told me this story told me that the relationship between that second child and her husband is so much better than the relationship between the first child and the husband, because they did not have a chance to bond prenatally.
Interesting.
So again, practical advice, both parents talk to the baby.
It's the bottom line. Yes. To nurture the relationship already. Just beginning.
Establish a relationship before the baby is even born.
So my husband is really interested in this idea, and just so much makes sense that we as parents we talk to the baby all together. But other papas out there, they don't really, maybe because they think that the delivering is just a wife's job, and it's overall, family's big project, but still, sorry, that maybe some fathers feel isolated because they need to be waiting outside the operating room.
Yeah.
how can moms in general like get their husbands more involved in this type of baby communication when they're in utero?
Well, the husbands, just like the mother, should start talking to the baby the moment that they know that there's a baby there, right from the beginning.
There seems some sort of maybe hesitation depending on family, and then
Yeah,
of course
yeah,
the
yeah,
partnership that they
yeah,
have, of
sure.
course. But
Yeah, but I understand the hesitation. Sure. It sounds kind of crazy, how can I talk to this to this little something, right?
mm,
Uh, but we have to start with the fact that that little baby already a little is a little human being, and it needs contact with the outside world. It needs contact with its parents.
mm,
So once we establish that fact, it makes it easier for the father and mother to talk to the baby, because they're not talking just to some little collection of cells. They're talking to a tiny, yes, but it's the beginning of a human being.
yes.
Uh, so you have to treat it like a child. You have to treat it like a small child. That's one of the reasons, right at the beginning, I said I don't like the word fetus,
Mm.
because
Yes.
there's no human there, right? It's fetus. It's you might as well call it a dead body or something.
Mhm.
So there's a little baby there. It's human. You have to start connecting.
Mm.
And even if it feels strange, do it. Just do it.
um Me and my husband, we are on the same page, like I told you earlier
Yes, you did.
session.
Yes.
But so we are fortunate to be able to have been able to do this like project talking to baby
Yeah. Right.
together. But so I get a lot of maybe like you describe crazy looks whenever my husband tries to spread the word, hey, this is good communication to cultivate really a good relationship with the baby. So but yes, that's maybe.
Well, you can always use sort of backup authority figures like Dr. Ikagawa, Dr. Verny, all the books he has, written, published. This is a person who has studied this all his life. I'm talking about 50 years of experience in this area. So if nothing else, these people, they're good people. They have integrity. They have science behind them. Let's do it.
Yes, let's do it.
Let's do it.
Thank you. Thank you so much for your advice. Okay, so moving on to the next one. So she's asking, why is prenatal education widely accepted in Japan? And I guess Dr. Akira has made a big contribution to this field. But in childbirth preparation classes, she's a hypnobirth therapist. And so that's why she's saying in her childbirth preparation classes, how can discussions about prenatal memories be received abroad? And what explanations might convince people from other countries to accept this concept?
Well, everything that we have been saying supports it, right? Um, all they have to do is read one of my books, and there's all the science to back it up. And but like I've said before, don't get sort of obsessed with prenatal memory. It's
Mm.
it's prenatal cognition. It's not only that the baby can remember, but it can think and feel. Okay, so we are dealing with a real human being. It would be as if he talked about, adult memory. How can we prove adult memory? Well, you can prove it in 1,000 different ways.
Yes.
Uh,
Mm.
if you would really need to read, a book like mine, uh, to have all the research from every corner of the world, to show that children can remember things prenatally. And there is very, very good research from lots of universities to prove that. And if you're not familiar with that research, well, then, read my book. Uh, I'm not trying to sell the book. It's just that all the research is there. And so if you want to have, read the Journal of Pre and Perinatal Psychology, as it is published by APA, the Association for Pre and Perinatal Psychology and Health. You can go to a website, birthpsychology.com, and you can find all the evidence there. You have to put in a little bit of work, but if people don't believe you, then you have to sort of show them the evidence. It's one of the problems that Dr. Ikagawa, have I got the right name?
Yes.
One of the problems that Dr. Ikagawa has is that everything is focused on memory. And
Oh.
and to support that, they have these videos of little children, remembering what happened prior
Yes.
to birth.
I've seen the movie he created. Yes.
Yeah, okay. But that's not proof. There's a big difference between that, let's say, and a university having a research project where pregnant mothers during the last trimester are being played two different songs, and one of them is sang by the mother, the other one is sang by somebody else. After the baby is born, they play this music to the baby. The baby will remember the mother's song, but not remember the other one. And will react in an obvious way. Okay, I'm just cutting it very short. But what I'm saying is that that's the kind of research that you want. Okay, which is measurable, scientific. You compare before and after. You replicate the experiment by different people. That's the kind of research you want. Listening and watching these little girls and boys is lovely, but it's not proof.
That's not enough to back up the.
No. That's a very good first step. Then you have to do research. Then you have to see that what they say really happened. You would have to compare before and after. So, when, for example, one of the first experiments was done in California by a hypnotherapist by the name of David Cheek. And he hypnotized the mothers and their adult children, taking them back to their births separately. So mother A was hypnotized, went back to her birth, told what happened. Then on another occasion, the daughter of this A lady was hypnotized, taken back. It's something like, I think 9 out of 10 cases, what the baby said and the mother said were exactly the same compared. So when the mother said, right, I don't know, right after the birth, we stayed in hospital for 1 day and then we went home in a blue car. The baby was asked, the baby said, right after we went home in a blue car. So there was one child that was totally wrong, totally wrong. The two did not compare. So then David Cheek found out, David Chamberlain, actually, David Chamberlain found out that this child had a horrific, very, very difficult birth. And so what happened was that when you have a difficult birth, there's so many stress hormones that they prevent memory formation. So this baby had a very twisted memory of her birth. And so she was wrong on all accounts. But 9 out of 10 were right. That's the kind of experimentation. That's the kind of research you want.
I see.
So it has to be before and after.
before and after comparison, and then
Yeah,
what
right.
we see
Yeah,
from the type of
right.
deep
Right.
dive research.
Yeah, because what anybody says, what you say and I say, let's say the question would be, what did you do on your third birthday? Well, you may or may not remember, but you will tell some kind of a story, and it will probably have a kernel of truth, but the rest of it is kind of made up.
Blur, yeah.
So our early experiences are very much colored by consequent experiences, things that, right? So the truth, not because you're lying, but it's just how the mind works, the truth gets kind of colored with past experiences. And so you can't rely on it. You cannot rely on what people say in terms of what they remember.
I see.
And then with some of the children, like that Dr. Ikagawa shows you in films,
Yes.
well, you know, when the children start remembering, they get so much positive encouragement. Everybody says, yeah, oh, that's so wonderful. Yes, tell me more, tell me more.
Yes.
So, that's like reward and punishment. So when you get the rewarded for your stories, you just make it bigger and longer and more beautiful, and people clap some more, and you're the center of attention, and it's wonderful for the child. But is it the truth?
Let's see. Are there any good tips on childbirth that we can use here in Japan? Any recommendations?
You know, the best childbirth is one where you have had a good pregnancy. A good pregnancy, and by this I mean with little stress, lots of support from the father of the child, from your environment. Perhaps you joined a prenatal class. Perhaps you listened to some good music. You did not exercise too much. You have watched your diet, eaten the right stuff, so avoided stress. All those things will help you to have an easy birth, easy, natural, unmedicated birth. That's the best way. That's the ideal.
So I'm on the right track.
You're on the right track. Yes, you are. Yes, you are. Yeah. And I think it's very important to have a good relationship with the father, as I've indicated, but also with the woman's mother. Also very important. And only have people in the birthing room who you love and respect. Like if you, let's say, have a bad relationship with your sister, just as an example, and the sister wants to be present, don't have her present. Only people who you love and who love children should be present at the birth. And then after the birth, go home with your child as soon as possible. Don't stay in the hospital. The hospital is full of bacteria. The hospital is for sick people. Go home, be healthy.
It's not for moms, pregnant women.
Yeah, go home as soon as possible. And breastfeed, of course, for at least 6 months. And 6 months at least, if necessary, up to 1.5 years. There's no rush. You know, you just have to follow your feelings.
I see.
But 6 months, yes. Because breast milk is good for the baby, and it's also good for the breastfeeding mother.
Lots of nutrition in it.
Yes. Yeah.
I see.
Let me say very early on, it's not just a question of memory. We are talking about the fact that during the last trimester, the last 3 months in utero, the baby is already a cognitive being, sensing, cognitive, remembering being. So it's more than just memory. That's what I'm trying to tell you.
Thank you so much.